Hello. Today I'm going to talk about an interesting topic which is becoming quite popular among the women across the world and in our country, India. So we know that sexual health is equally very important aspect of overall health, and problems in sexual health can lead to decreased quality of life. So we are going to talk about non-invasive intimate rejuvenation or non-surgical vaginal rejuvenation, which is done with different lasers. So it helps women to address a lot of concerns that come along with the natural process of aging, post-pregnancy or childbirth. So let's talk about the indications of laser vaginal rejuvenation. So first indication is like simple vaginal rejuvenation. So what is vaginal rejuvenation? It's simply the tightening of the vaginal canal, which is very common in women after bearing the children, or as they age, or women who are sexually active. So the orifice of the vaginal opens and it leads to decreased sexual gratification. So once you do the laser vaginal rejuvenation, multiple stains, so that person experiences a better sexual gratification. So this is the one indication. The other indications are like the other indication, for example, is vulvovaginal atrophy. So what are the symptoms of this vulvovaginal atrophy? It's dryness of the vagina, it's itching, the soreness, the dyspareunia, that's painful coitus. So doing the laser vaginal rejuvenation, it can ameliorate it can help you to decrease the symptoms of vulvovaginal atrophy. And apart from that, some symptoms which do come in females who have been multiple pregnancies and normal vaginal births, the symptoms like urine incontinence, and many women do experience dryness of the vagina, and that also leads to decreased sexual sensations and all. So these are and one more important indication is the laxity of this area or prolapse of the vaginal prolapse. So these are other medical indications for laser vaginal rejuvenation apart from simple vaginal tightening or vaginal rejuvenation. Now, how it works? Simply, laser is a novel approach and a non-hormonal approach for genitourinary symptoms. So basically, here we use the carbon dioxide laser. Is an ablative laser, fractional beam of around 10,600 nanometers is used, and that actually gives coagulation and ablation to the vaginal mucosa, which leads to the wound response. So ultimately, it leads to neocollagenization and elastic fiber formation. So that way it also helps to give the tone to the muscles and gives and the supporting tissue, and that's how it works. So with the laser, the tone of the muscles are restored, and there's a tightening of the supporting tissue, and the mucosal and the vaginal canal becomes more competent and becomes more narrower. So basically, now what is the treatment protocol? The treatment protocol is simply the laser is performed. We don't need any anesthesia. It's an OPD procedure. It takes around 15 to 20 minutes. And it's done with a duration of 1 month apart. So basically 3 sessions are required. So treatment time is quick, and there's no discomfort associated with the treatment, and except mild itching can happen, and a patient can restore the sexual activity post 1 week after the treatment. So in conclusion, laser vaginal rejuvenation is a good treatment for women who are sexually active and want better gratification. For women who have vulvovaginal atrophy, symptoms like dryness, urine incontinence, soreness, dyspareunia, It's good for women who want to marry again. It's good for the women who have completed their family and they have the children's and they want to enjoy their sexual life. And these are certain indications for laser vaginal rejuvenation, apart from the women who have urine incontinence. Thank you. I hope you got the information about laser vaginal rejuvenation.